Good morning, John. Welcome to our clinic. My name is Dr. Smith, and I'll be taking care of you today. First of all, I want to apologize for the delay. Unfortunately, today has been busier than expected, and I appreciate your patience. But now that we're here, let's focus on getting you the care you need. So tell me, what brings you in today?
Good morning, doctor. I've been having a sore throat and difficulty speaking for 3 days now, and it's really starting to worry me. I'm not sure what's going on, but it's not getting any better.
I understand your concern, John. I'm really glad you came in today. It's important to address these kinds of symptoms early so we can figure out what's going on and get you on the path to recovery. To get started, I'm going to ask you some questions to better understand your symptoms and how they've developed. Is that okay with you?
Yes, of course, doctor.
Great. Let's start with the basics. Is this the first time you've experienced these kinds of symptoms, or have you had similar issues in the past?
This is the first time, doctor. I've never had anything like this before.
And when exactly did you first start noticing these symptoms?
It started about 3 days ago. At first, it was just a mild irritation in my throat, but then it got worse, and now it's hard to speak without pain.
Besides the sore throat and difficulty speaking, have you noticed any other symptoms, such as fever, cough, or maybe something else?
Yes, I've had a mild fever that comes and goes, and an irritating cough that's been keeping me up at night.
Thank you for sharing that, John. Those details really help me get a clearer picture of what's going on. Now, I'd like to perform a physical examination to check your throat and listen to your breathing. Can you open your mouth wide for me, please? Say, ah. Perfect. Thank you. Based on the symptoms you've described and what I'm seeing during the examination, it looks like you're dealing with laryngitis. Laryngitis is essentially an inflammation of the voice box, or larynx, which can be caused by overuse, irritation, or an infection. It's quite common, especially this time of year, and it can be very uncomfortable, but the good news is that it's usually not serious.
Laryngitis? Is that something I can treat quickly? I'm a bit anxious because I have an important meeting with a client in just a few days, and I need to be able to speak clearly. Is there any medication that could speed up the healing process?
I completely understand your concern, John. Having to speak in an important meeting while dealing with laryngitis can be quite stressful. Unfortunately, there isn't a quick fix for this condition. The inflammation typically resolves on its own within about 7 days, but the key to recovery is really about giving your voice time to heal. That means avoiding whispering, staying hydrated, and most importantly, resting your voice as much as possible.
7 days? That's a bit long. I'm really worried about this meeting. Is there absolutely nothing I can do to speed things up?
I hear you, John. It's frustrating, especially with a big meeting on the horizon. However, using your voice, especially for something like a presentation, could actually make your symptoms worse, prolonging your recovery. It's really important to rest your voice now, even though it's inconvenient. Sometimes prioritizing your health is the best thing you can do to ensure you're at your best when it really counts. Do you agree?
Yes, I see your point. I guess it's better to rest now than risk making it worse.
Exactly. It's a tough decision, but it's the right one for your health. In addition to resting your voice, I also recommend drinking warm liquids like tea with honey, which can soothe your throat. Gargling with warm salt water can also help reduce irritation. You might also try some ginger root in your tea for its anti-inflammatory properties. These steps won't necessarily speed up the recovery, but they can make you more comfortable while you heal.
I'll definitely try those, doctor. I just really hope I can recover as quickly as possible.
I understand, John. I want to make sure you're on the right track, so I'd like to schedule a follow-up appointment in 5 days. This way, I can check on your progress and make sure you're healing well. In the meantime, please follow the guidelines we discussed to give yourself the best chance of a smooth recovery. Is there anything else on your mind that you'd like to discuss?
No, doctor. That covers it all. Thank you so much for your help and advice.
You're very welcome, John. I'm glad I could assist you today. Remember, your health comes first. Take care of yourself, and I'll see you in 5 days. Have a good day.
Thanks, doctor. See you soon.